Yes. Okay. Good afternoon. And so we have some good numbers for today, and I'll talk about that in the context of what we've seen over the earlier parts of the week and the weekend, and to how that goes in that perspective, and how do we take that on a go-forward basis of how we're doing in regards to our ongoing measures and stage one of phase two in that regard. And I know there was already some press with the Premier and the Minister talking about long-term care homes, and I know they addressed an issue that was very concerning and one that they have committed themselves to look into in that regard. So I'm going to stick with the numbers here today. And so first of all, our numbers, we're down to 287 today, so that's a pretty substantial drop from where we were yesterday at 404, and earlier the day before that up in 460 range in that regard. So that gives a total of 26,191 confirmed cases thus far since January. And again, our distribution is about 43% male, 56% female, and 41% about are above 60 years of age or older. And most of them are in the Greater Toronto Area, 65.1% of those. And most of the ones tend to be the numbers significant in different areas, mostly Toronto Public Health, of course, Peel, York Region, and to some extent Durham as well. So you can see how our distribution is in that regard. I'll talk about our testing in a moment. The number of healthcare workers who have tested positive is now to a total of 4,485, and that's a cumulative number since January. And we continue to see people recovering. We're getting close to 20,000, just underneath of it, 19,958, which is a 76% rate. So that is another good news issue there. On the hospital side, we're seeing 848 hospitalized. That's a decrease of 11. The number of people in ICU is 143, a decrease in 5. And those in ICU on ventilator is 113, a decrease of 1. So all those are positive as well. Tragically, of course, we're still seeing deaths occurring. The numbers are down a bit to 21 for a total of 2,123. And so that's down from some of our higher numbers this week, yet still concerning, and one we would like to see reduced considerably further. Our long-term care and retirement homes, that's also going in a positive direction. 201 active outbreaks at this time. That's 297 cumulative, so the number have dropped down from that. 4,892 cases in the residents. And when we look at the LTC data, they seem to indicate they've dropped their outbreaks down to even lower, to 150, and they have reduced even further the residents and staff. So that's all going in a positive direction. And the 4 deaths reported in IFAS for the healthcare workers were noted. And on the long-term care data, they reported that 7 deaths were related to COVID-19. So all those are reducing and going in a better direction at this time. The retirement homes, 50 in outbreak, no change, and 188 deaths, no change. And staff and residents, 2 staff and 6 residents, so going down smaller numbers. So it shows you that curve in that area there is improving, and that is encouraging. The total tests completed thus far, 629,414, and our tests done today, or yesterday I should say, by the end of the day yesterday, 9,875. So that is encouraging, and we have another 6,961 under investigation pending. And so with that in mind, where are we? So as I said before, we were up high this week at 460. The last time we were down in the upper 200s, remember we had a data error that popped us back over 350. So it's been a long time since we've done to 287, and we did check the data. There's no data flow issue this time, so it is accurately reported. And so we'll take that as an encouraging aspect there. I should mention as well the positivity rate has dropped from 6.5 down to 5.0. So that's also moving in a good direction. And those are some of those indicators that we had mentioned earlier that we were wanting to pause any further changes in the social aspects, the distancing and other things in our public health measures division, I should say table, until we saw this flow and direction. But today is one day. And I would say take that with a grain of salt so we can see if it will continue as the week goes on, knowing we sometimes start climbing up as we look at our bad data patterns in the last number of weeks, rising up a bit higher on Thursday and Friday. Let's see how it goes. Plus, the fact that this day we did over 9,000 tests, whereas usually by this time on Tuesday, which represents Sunday, we're well below 8,000 down to 7 and 6,000 tests. So the increase memo and materials out to encourage people to go forward and getting testing. We're hearing anecdotal information that that is occurring. And the fact that we quickly bounced up from 8,300 yesterday back up to over 9,875 probably gives evidence that we're getting more uptake on that as well before we even start even some of the other broader testing surveys that we have looked at and we're considering in our overall strategy. So in general, besides having concerns with some activity on the weekends, we do see sometimes some increased blips a few days later, and we'll see if that happens this Thursday and Friday related to the Victoria Day weekend in there as people find it rather difficult to stay disciplined in that regard, whereas most of the people in Ontario have maintained that, and that's encouraging, and we want you to continue to do that at this time because we'd like to see this number stay down below 300 if we could. But again, it's only one day. Encouraging as it is, let's see what happens tomorrow and the next day. So with that, I'm going to take questions from the media. Thank you.
We'll move to the phone line for questions. Just a reminder, one question, one follow-up.
First question comes from Haley Cooper from News Talk 1010. Please go ahead.
Dr. David Williams, in light of the report that's been released today, are you considering maybe relaxing some of the restrictions that you've put in place, allowing loved ones who are non-essential visitors to go into long-term care homes and check on their family members to make sure they are being cared for and that they are okay?
So I think when you mean the numbers, known to the 287, the other ones related to the long-term care numbers there. And that's really in the direction of the Ministry of Long-Term Care, as well as the IMS table that is reviewing all those aspects. We have given some documents that would look at some increased visitors. I think what the important part to remember in the issues that were raised today is that, as you know, you have the military in 5 of those homes, and you have many of the hospitals in a number of other ones that the IMS table had considered of concern. The point being is that we don't want anyone left uncared for during this time of the outbreak and dealing with this the impact of that at this time. So I think that was one of the steps by bringing in the Canadian Armed Forces, because the Premier and others did not want to see areas where, because of staff shortage due to quarantine, that long-term care residents were left uncared for. And so there's some more steps to do that. And you can see from some of the discussions today that the Armed Forces have come in and done an excellent job at the 5 homes that they're involved with to make sure that that did not occur, was not occurring. And of course, I know the number of the hospitals have stepped up and are doing their part as well in that. On your point, yes, we continue to look at when we can get the green light, if you may, to start allowing more family members in, because it is impactful and we want to understand that. And having had family members in long-term care myself, they really do depend on those type of connections. And so it is something much like the Premier would like to see if we could get that up and running, but not such that it puts them back at risk again, because as some of the numbers, we still have community spread to some extent, and we do not want to reintroduce it back in, either through visitors and or staff again. So we want to be cautious and yet caring and compassionate at the same time.
Follow-up?
Do you have any concerns that loved ones are going to read what was in those devastating reports and think that their loved one is better off outside of long-term care in their own home? So bringing their loved one out of long-term care in their home, do you have any concerns about that happening and then us seeing an uptick in community spread?
You have to remember the ones we're talking about is a certain percent. I think the total is around 20 odd out of the 690. A number of the ones through our survey were found to be not in severe outbreak mode. The IMS group has identified any ones of concern. So this report comes when the military moved in with their group, as well as the IMS group had already moved in with some hospital action in the concerning ones almost 3 weeks ago. So that is what their concerns were when they went in. I can assure you that that's not the condition it is as they're in there now, and neither is the hospital ones in that state. So I think the urgent request is I think should be abated to some extent. At the same time, we can understand why people would feel that way. I'm more concerned if you took them out of the home into the community setting, will there be a chance of reinfecting them in that location, as well as sometimes the complexity of care that's necessary, as a number of the family members are dealing with the ongoing constraints, as well as potentially returning back to work and other aspects in there. So it's not a simple answer. It's a complicated one that has to be worked out, and yet individuals will have to assess the situation themselves and make decisions that are appropriate with the ultimate goal of the care of their loved ones, and be reassured of that by asking the organizations and the ministry accordingly.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
You know what? I'm okay. Thank you.
Next question comes from Derek Dionore from CBC. Please go ahead.
Thank you. Dr. Williams, we've crunched the numbers, and they show that 90% of new cases are happening in just 8 public health units. So that's the GTA, plus Ottawa, Hamilton, and Windsor, Essex. A lot of health experts say this means you don't need to keep the exact same restrictions in every part of Ontario. Both Quebec and Alberta are taking a regional approach in their provinces. So why aren't you recommending that for Ontario?
So our public health measures table, and you raise a good point, and we're trying to look at that to say, are we now honing down into certain areas that have priority? And we have some health units that have had no cases for a number of weeks, and yet when we went over our 460, it surprised me how many had 1 or 2 cases throughout the province, which was disconcerting. Some still stayed at 0, and so we have clusters in different areas, as you've alluded to there. And so we're addressing that issue, and how would one undertake a varied model that continues in there, and as can we contain it within certain zones and aspects there. So it's an issue that we're addressing. We've tried to make it on a pan-Ontario basis, knowing that by doing regional responses, can you restrict travel between all these ones, especially to adjacent areas that may be very close, but you say people can't travel in and out, and the implementation is challenging. You can do it in theory, but the practice will be, I think, at best difficult. But we are considering, and we're trying to look at that as we see this evolving over this week, in our first full week, going to the second week of stage 1 of phase 2.
Follow up, and it's the last question.
So just to follow up on that, what are some of the challenges, I guess specifically, you touched on the fact that you guys are looking into it and addressing it. What are some of the, I guess, the major challenges that might, prevent this from happening as far as regional restrictions?
Okay, so let's say, everybody's at stage 1. So we've opened up a lot of curbside, the 6-foot distancing, et cetera, et cetera. And we're watching to see when we go to stage 2 in the future, after we posit this for 3 to 4 weeks. So we have to ask ourselves, what would be regionally very important to open from one area to the next? So if you have 2 adjacent areas, and one is open, the other's not. So I'm trying to think of an example of something that might be open, like, let's say hairstyling, one's open and the other's not. So then everybody from this one just drives over and gets their hairstyle in that one. And so you bring all those infections over there. And if you're going to put, if there's all kinds of back roads and country roads, how are you going to block all that from people coming? So intra-provincial blockage is really is a challenge in that way. There may be ways to help with that, and how would one go about implementing that in a way that's workable for the public and as well enforceable by authorities in that regard. So that's just an example. I don't know if that helps you.
Thanks, everyone.
Okay, thank you.